Welcome back to Sunrise. Viewers, are you familiar with the saying, no pain, no gain? Well, for the past few months, persons in Jamaica have been using non-professionals to install what are called fashion braces for as low as $18,000. This morning, we're going to find out if these fashion statements are worth the future complications and what is the thought behind fashion braces. So we're going to speak to experts. Joining me this morning, I have Dr. Heather Dawn Lawson-Myers. She's the owner of Ligani Family Dental, Lisa Pinkney Gale, a dental surgeon and owner of the Mount Sinai Dental and Implant Center, and Dr. Anna Law Aline, an orthodontist. Welcome to Sunrise, ladies.
Thank you.
How are you? Good?
Good to be here. Good.
I feel a little bit in the dark because I feel like this is something I should have been hot on, and I'm totally out of the loop on it. So how long has this trend of fashion braces been going on? And anyone can jump in.
I would say at least about 4 or 5 years.
Yeah, about 4 or 5 years,
It's been taken off.
4 or 5. And what about in Jamaica? In Jamaica, it's a 4 to 5.
For about 4 or 5 years, right? I mean, I remember reading an article in The Star about 2016 where they actually did an interview with someone and actually sent someone out into the field to test out one of these services. And there was an article done, and I think you were quoted in that article at the time as well, addressing the whole issue.
Right. And in your field, you're actually the one who is putting on the non-fashion braces.
Right, the real braces.
The real braces. And for our viewers, most people know what braces are, but you can probably explain to them what is the purpose of even getting braces, the true reason.
All right, well, braces are to align your teeth. You may have problems with crowding. Your teeth might be crooked, maybe your jaws don't fit properly. You could also have temporomandibular joint disease or jaw joint issues, and that can be caused by your teeth not fitting together properly. But mostly people want to have better health. Because when your teeth are straighter, you can clean them better and maintain them better so they can last for the rest of your life. Right. And once you're in that position, you also look better, and it gives you confidence to face the world, your job, just at school, and so on.
Well, I guess you could also comment on the benefit of having braces in terms of the fact that it's not always aesthetic, right? Sometimes there are medical reasons for it.
Oh, absolutely. For example, even the temporomandibular joint dysfunction that I mentioned earlier, if your bite is not coordinated, your jaws are not aligned well with the teeth, that can give you problems with your jaw joint. So there are other medical issues that can crop up that patients may have if their teeth are not fitting together well. Right. And then also if you can't clean properly, then you're more prone to periodontal disease, bone loss, where you can lose your teeth. And there are other issues with gingivitis from someone not being able to address those areas properly.
Right. All right, Doc, so I'll ask both of you the same question. What has been your experience in terms of the fashion braces in your practices?
Well, I'm in private practice. I don't say an overwhelming number of persons, but I think Jamaicans are kind of very forgiving. Some unknowingly have gone to people who are not qualified and have simply been okay to be referred to someone who is qualified. And I just want to pause here to say something. I went to university, and then I did 4 years of dental school. After that is when you would do the additional training to become an orthodontist, who is a specialist who deals with the alignment of your teeth.
Right.
There may be 1 or 2 general dentists who have done additional training, but not the full course, and they do limited tooth movement. But the point is to be able to move teeth in bone in a healthy fashion so that you don't lose your teeth, so that you don't mess up your jaw joint, so that you are in a healthy state. At the end, you have to be properly trained.
Right. Absolutely. And
okay, so I work both in the public and in a private setting, so I tend to see a lot more of these cases sometimes, both public and private. And while we are unforgiving unknowingly, sometimes we are also knowingly placing these appliances because of the fact that it is cheaper to get the fake than the real thing. But as Doc pointed to, we don't understand that sometimes we have some deleterious effects from these, because when you're manipulating teeth, tooth supporting structures and bone, you may not have short-term damage, but you may have long-term damage as well. And what I tend to see coming in is persons that now have pain associated with the installation of these appliances. But then what we need to also speak to, what we don't notice, is that we have to speak to infection control. Because you do have these persons who are placing these appliances in the back of vehicles in non-dental environments.
Before they're put in.
Right, in there, that's where they're placing them. I've had patients that have come in that they place it in the back of a van, or they just place it in some, they're mobile, so they move to your location. So we have to speak to this as well. You know, with everything that is happening, we have to just inform you, so you can make informed decisions as to how to move forward.
But clearly there's a great deal of ignorance to of course, the complications.
There still is a great deal of ignorance. You see, we only see what we want to see, the aesthetics, but we don't take into consideration other complications.
This may step a little outside of the field, but how do you ladies feel about the purpose of people doing it, the social reason? What do you think is behind it? I mean, I can assume that it's tied into a lot of deep things, but what's your opinion on the reason people are doing it?
You do have persons that, because there are some that advertise it as fixing the problem, you know, but a lot of persons do it for fashion.
So they fall into the unknowing who think that they're getting cheaper.
Right. There's some patients who realize that it's not real or it's fake, and they want to do it. One girl actually came to our office and said that it was her birthday.
Right.
So she just got fake braces. And she didn't have any excuses about that. That was just it. But then there are also patients who come to us because they found out from someone else that the practitioner that they're seeing is not genuine, and now they're trying to make corrective measures to that and make a change. Some patients actually have some very serious damage. I had one patient, her roots were protruding outside of the bone.
Wow.
Right, and she was told by the practitioner, oh yes, everything's going fine. Just continue on, I will fix it. But then she started having pain, as you mentioned earlier. Her face was changing in a deleterious way. She was looking worse than when she went to the person originally. So that's how she actually found the proper orthodontist. And at that point in time, it then cost more to correct the problem than what she had originally.
Way worse.
So that's something that I have to take into consideration as well.
So Mario, wearing braces, it's not like wearing jewelry.
Yeah, I know this. I never had them.
And the challenge is when you're looking at something externally, you know, you make a decision as to whether it's appealing to you and what does it mean in terms of social status, etc., etc. But the reality is, it is a medical appliance creating a vehicle for correcting something that has a visual. So you look at the visual and you say, I want that. But the I want that is not cosmetic.
Right. And
It really creates a different fit of the teeth, challenges with the jaw. If they're not managed properly, the gums, the tissue become inflamed. If you don't have proper oral hygiene, the teeth get decayed. Things can deteriorate very rapidly. So we want to ensure that people are informed so that they can make informed decisions. I see people all the time. I refer persons to the orthodontist all the time. 99.9% of the time, it's because of a medical, dental condition, not because of aesthetics. You may get an aesthetically pleasing result at the end, but the purpose for me as a dental surgeon referring a patient to the specialist is to help with their overall health.
Exactly.
Right.
And there's nothing wrong with wanting to enhance your appearance, but go a route where you can be guided with someone who has the skills to give you a win-win something that looks good and functions well.
Ladies, we are, I can't believe we're out at 10. I feel like I could talk about this all day. We may have to bring you back.
Great.
But thank you for the work that you're doing. And just give me one final word on what you want to encourage people to do, just quickly.
Well, basically, we just want to inform persons, and we just want to mention quickly that it is a purview of the Jamaica Dental Association to just inform persons, not to castigate or perpetuate any legal action against anyone performing these activities. But we just want to keep persons informed so you make informed decisions.
And they can contact the Dental Association
Right,
of Jamaica.
yes.
Right, the Jamaica Dental Association or the Dental Council if they want to find out if these persons are registered
Legitimate.
with the Jamaica Dental Council.
Ladies, thank you for teaching me so much about this.